Today, we're in Massachusetts at FIXT. What's FIXT? You're going to want to know. Stay tuned. That was so fantastic. We are in Wellesley. Is that how you say it?
Wellesley.
Wellesley. Wellesley.
Wellesley.
Wellesley. Wells. I like that. That's the name of this town.
That is.
How long have you been here at this practice?
We've been here about 3.5 years, almost 4.
Okay. Your dental journey started what year?
Oh, my dental journey started way back about 24 years ago.
Okay.
Yeah. So
And now you have, is it 3 locations?
we have 3 locations.
Okay, tell us about this location in particular.
So this is our flagship practice. It's the only one of our locations that was a scratch startup. So there was no dental practice here before. This was something that back in 2021, my wife and I had sort of the vision and the desire to let's see what we can build on our own. You know, we
Okay.
wanted to make it our own, design the practice, the flow of everything from scratch. And so we just started kind of marching down that road, and every idea that we were writing down, I had written down ideas for over a decade of, you know, if we ever build it someday, I want to have this, and I want to have that, and I want it to work that way. And we started bringing it to life, yeah.
You are the future.
I hope so.
This practice is the future.
The bank says I have to be, so.
To me, what's so extraordinary is that it's one stop. People walk out of here with teeth.
They do. Correct.
How does that happen? How are you able to provide that for your clients? Let's walk through the process.
Sure. So I a lot of times I explain to my clients that, you know, it's my job to make this very, very complex series of procedures look and seem simple, right?
Okay.
And so it's really been sort of a passion and an obsession of ours over the years. It's a combination of skill set, of knowledge, of education, but then also technology, some engineering, and employing all of those moving pieces together, because the complexities of what we do, having someone come in with big dental problems and then leaving with teeth that look like it's all done, or that it's always been there, that it's just beautiful and it works and it feels good and it's strong, especially when we're doing that all in the same day. You know, there are a lot of moving parts, pieces, and people who, you know, that client is their full-time job that day, and then even beyond as well. And so it takes a lot of coordination. A lot of times I say, you know, it's like having an orchestra. I know how to play every instrument in the orchestra, but it's my job to really do this. You know,
Yes.
is that I'm directing each of those different compartments of the orchestra here and bringing that together.
It works so well, because I was
does.
talking to some of your team, and the thing that I liked the best was the fact that it's very patient-centric. It's all about that patient, not just giving them, and I was making a joke. I said, oh, it's not like you take George Washington's wooden teeth and it's the same teeth and you're just putting it in the mouth.
Correct.
No, you're creating something,
Everything
like a
is
piece
tailored.
of art, like
Yeah.
a sculpture
Correct.
that they get to wear that's just one of a kind for them.
Right.
I think that's beautiful.
I think
so.
so
The
too.
smiles you're creating are their smile. You're finding their personality and you're bringing them to life.
That's the goal. And
Okay.
so sometimes, you know, I'll have a client that brings in photos. They say, once upon a time, I loved my smile. I've lost it since then because of, you know, various stories that caused them to lose their smile, lose their teeth over the years. I have others that say, hey, I used to have more teeth than this, but I never liked my smile, so I don't want you to recreate what I had.
Okay.
And sometimes they may say, you know, but my son or my daughter has beautiful teeth. And, you know, we'll say, well, you know, there might be sort of a genetic relation there where maybe we can copy that, or maybe we'll start from scratch. And
Okay.
so we try to find and tailor for each individual what's going to look right for this person. I like creating smiles that look beautiful, that look natural. My goal is that, you know, friends, family, people that you know or don't know, just think, you know, you've just always had such nice teeth, and you probably never sat in a dentist chair, and I don't want it to look like, pow, you know, you must have just got veneers, right?
Right, exactly. You don't want their smile to enter the room before they do.
Yeah, if a stranger at the gas station compliments you on your veneers, that's a failure in my book, right?
Right.
If it's so white that it glows in the dark. Now, I have some folks that they want that. You know, I tell them, you know, I can make that. No one's going to believe that those are the teeth that God gave you. And for me, that's the same as asking me to make your teeth purple. I can do that too.
Right. But should we make
Don't tell
your teeth
anyone
purple?
that I'm your dentist.
So you have had this practice now, and what happens is from the moment that they walk through, right, they're just treated like the celebrity and the beautiful person that they are, the uniqueness of that person. So you measure them. I guess, do you work with people that aren't just cosmetic patients, but the people that actually you have to recreate their smile because they've had an injury or?
Oh, certainly.
Okay.
And so, yeah, there's sort of the cosmetic and aesthetic side of dentistry of what we do, which is, you know, making things look beautiful and making things look natural. And there's the reconstructive side of things where maybe there's been an injury or maybe there's been a history of drug use and abuse, and someone's been sober now for 10 years, but the scars of that history still remain. What's I think very unique about my team and our practice culture is that it is an absolute zero judgment environment. And
Beautiful.
so we've heard every story you can possibly imagine. I have multiple people that sit in my chair every week, and they sort of they break down and they kind of feel like, you know, I would bet that this is probably the worst that you've ever seen, and
Maybe not.
you have no idea what we've
Right.
seen. Right? You know, I have seen it all. There's nothing that can surprise us now these days. It's so normal to us, and we don't see really what the problems are right now. You know, our minds all sort of look toward the potential and what this can be, and we just want to get to know you, the person. How do you want this to be? I'm going to draw the map that gets you from where you are to where you want to be. And right now you feel lost, or you feel like, I don't know if I could ever get to that destination. And so I say, one of the big jobs, especially in our first meetings, is, you know, I'm the map drawer, right? You know, I connect the dots from here to there. A lot of people will look at those plans and that map, and they say, wow, it looks expensive. Sometimes it is, a lot of times it is, right? You know, but the nice thing about having a map is that if you have your present location and you have your destination, well, you have some options also. You can walk the path, you can run part of the way and then sit down, take a break for a little while, and then we can go complete the job later. Or you might say, hey, I want to get to that finish line as fast as possible, let's take a jet.
Or a DeLorean.
So, yeah, or a DeLorean, right? You know, you can take a time machine. I can get you back there, you know, a few weeks ago. So that's the beauty of what we do. We're goal-oriented. We want to know, where's this supposed to end?
Okay.
And, you know, here's the list of things that look very, very complicated, but we're good at making friends, and we're all going to be friends at the end of all of these appointments, and we're nice people because we do every step here in the practice. And so if I was a big fat liar and I hurt you in the beginning, right? You're not going to come back and let me finish the job. You're going to say, I don't like that guy, right? So we have every motivation to make sure that we deliver on the things that we say that we can do. It's different if you're at one of these dentists where you're going to 3 or 4 different dentists and locations, and you go, you know, a couple of these appointments are at the oral surgeon that is kind of a jerk or you don't really like, but you know, who cares? You find out when you go there for the appointment, you have something done, you go, that wasn't a great experience, but I don't ever have to really see that guy again, right? And, you know, that can be traumatic for some people, but
here
we
it's not.
we make sure that we deliver on that experience no matter how simple or how complex or where we're headed.
I like the fact that you document things too. This is the before and then the after, right? I love that you have the technology. You have technology that a lot of places just don't have.
Correct.
You've invested in that technology. So you have, you know, the state-of-the-art science. Like you said, you had a background in science. We were talking earlier today. You took that science background and now you have the best of the best science. You're putting that together with artistry. You have people here that are actually like sculpting this and painting the ceramics and making it just natural and fabulous.
Dentistry
and it's
was
here.
not, and it's all right here. It's a team effort, so you know, like I said, I get to be the conductor, but I'm not always playing all of the instruments, right?
Okay.
You know, I understand everybody's part, and that's part of my job, and I've done each of those parts and roles before. But I want to make sure that, you know, it's a system that's all coordinated and that feels cohesive, right? Dentistry was not meant to be where I was headed once upon a time. I was heading down the road of doing science.
Right.
But what I found in dentistry was the perfect combination of biology, chemistry, physics, engineering, and art, which were all of these boxes that I wanted to check but thought that I never could, and here we are.
And
you know,
here
and
you
so
are.
I get to connect all that science with the beauty and the art and the person and making happy people.
Speaking of making happy people without naming any names, is there a case that sometimes when you put your head on your pillow at night, you're like, I'm going to get teary, but like that you're so glad you're able to help that person?
Oh, certainly.
Many,
Yeah.
probably,
Oh, many.
right?
Yeah.
Okay, walk me through just one of them. Like what happened? Situation was what? Person presented to you with what?
Yeah, I mean, some of my favorite cases are those that kind of start with someone who's been out of the system in dentistry for 10 or more years.
Okay.
And some of my favorite cases are actually my patients who are in recovery from addiction, and they've done the hard work. They've made these changes in their lives. I have one amazing case in particular. She was a social worker helping other people kind of get their lives together after addiction, and yet the scars of those choices early on in her teenage and early 20s were still present. And so if you were to meet her, you might wonder, is she an addict?
Right.
And very minimal bone. It was a challenging case for sure. And I think, other dentists that kind of looked at this and said, there's nothing to do here but dentures, and even those are going to be awful for you. I looked at that, we were able to find that, this is very solvable. And it was a big financial leap for this client. And this was probably about 3 years ago now. And she broke one of my rules post-op. So it was a big financial leap. They did some financing to figure it out, and they said, we're going to figure out how to make this work. I don't know what else we might have to sacrifice in our lives. It was less than 24 hours after the procedure. She was feeling so confident. She still had a little bit of bruising, a little bit of swelling, right? After it was a big surgery. But this is less than a day after surgery. Now, the instructions were go home and watch Netflix for 3 days. Like, just take it easy, no yard work, don't be doing anything, right? Let everything just kind of settle down, take it easy. Less than 24 hours later, there was a job position that opened up. She went to a job interview, and she said, I would have never interviewed for this job because I was ashamed of how my teeth looked.
Wow.
Went to the job interview, landed the job, explained why she had bruises on her face, and just said, I'm ready for this next chapter of my life. Was making over $20,000 more per year because of the job, and then comes back in her 2-week follow-up, tells me the story and says, we figured out how to pay for it.
Yeah.
And it's actually because of, and I have a lot of stories like that from patients who say, what I'm ashamed of or what's going on here is holding me back, right? It's holding me back from kind of getting out there, whether it's, in relationships or whether it's in work or jobs. And, when we change that confidence and that thing that bothers you, it just opens things up, opens up the world. I usually have I have that effect on everyone. I have a box of tissues in every corner, but I don't have one here.
Usually it's so funny because I've interviewed a lot of people over the last 20 years of my life, and it's so funny because usually I'm making them cry. But today you made me cry. Oh. Thank you for the happy tears. It's lovely to meet you, to meet your team, to see that you're changing lives, and we were very excited about coming here to celebrate you. So, and thank you for the ride in the DeLorean.
My pleasure.
Back to the future.
Yeah.
It's lovely.
Yeah.
Just had the greatest time here, so thank you so much.
I'm glad that you did.
Yeah.
Who knew you were going to have fun at the dentist?
Who knew that I was going to wake up today and get to time travel with you? Who knew? And have fun at the dentist. Well, there you go. We hope that we took you on this amazing journey. Google them, find them, follow all their socials. I'm Donna Drake. I had the best time here. Thanks for watching.